I'm Cindy Henderson, the Chief Strategy Officer here at Veristat. Sponsors have many different ways of outsourcing their services to CROs. We believe at Veristat that there are tremendous benefits to having all of your data in one place. So having all of the biometric services, your data management, your biostatistics and programming, your medical writing services with one vendor brings tremendous efficiencies and benefits. Let's listen to my colleagues, Aaron and Terry Lynn, as they talk more about the benefits of bundling these services together.
At Veristat, we consistently say that early and frequent cross-functional collaboration between biostatistics and data management teams positively impacts the efficiency of deliverable timelines and ensures that clinical trial data is reliable and well prepared for regulatory review. I'm sure Terry Lynn has even more examples, but some things we've encountered when statisticians were not involved during database development were only the date and not the date and time were recorded when there needed to be a check if something occurred within 36 hours of the first dose of study drug. Also, the way that end of treatment and end of study are collected can have substantial impacts on data analysis, as well as requirements for data validation specifications. No one wants extra surprises, especially ones as massive as the ability to correctly identify analysis populations and have complete and accurate study reporting. Now you might ask yourself, what does Veristat do to mitigate these risks? Well, our lead statisticians review CRFs during database development. We provide feedback to data management on any data issues identified during programming activities, and mid-study updates are discussed cross-functionally with biostatistics and programming review and approval prior to implementation.
I couldn't agree more, Erin. It's really, really important for data management and for the study, the success of the study, for statisticians to get involved in the process early, starting with eCRF development. As you mentioned, statisticians and data managers at Veristat work together to ensure that all information needed to evaluate study endpoints is not only collected, but collected at the right level of detail. There's also another aspect of making sure that we are collaborating well, and that you mentioned earlier as well, in terms of getting statisticians involved early in the process during our data cleaning process. The data managers, of course, are very diligent in cleaning the data and looking for anomalies and getting them addressed, but there are just simply sometimes things that aren't apparent or don't pop up until data are summarized or derivations are applied. And so it's really important to get the statisticians involved early in running the table listing figures, reviewing the output, and providing feedback to data managers in the data issues that they're finding, so that, as you pointed out, Aaron, nobody wants surprises at the end. We work together collaboratively to ensure that you're reviewing the data from a statistical point of view, letting data management know what you're finding and allowing us to address those issues early on and not leaving them till the end at database lock.
That's right, Terry Lynn. We never know what's going to happen in a clinical trial. Sponsors need top-line results in days. No one wants surprises after database lock, and absolutely no one wants a hard code.
Definitely no hard coding and no surprises after database lock. And that's why it's always great to be able to collaborate with you and your group, Aaron, and make sure that we address these issues early.
Likewise, Terry Lynn.
As you heard from Aaron and Terry Lynn, there are tremendous benefits in having one vendor provide data management and biostats and programming activities on your study, and collaborating from database build all the way through to database lock. Taking this one step further, having one vendor manage data management, stats programming, and even medical writing across your entire program ensures consistency from study to study and across the programs, efficiencies that can shorten your timelines, which leads to cost savings, and ensures that a consistent story and message can be told in the individual clinical study reports through the overall clinical summary documents. Contact Veristat to learn more about how we can help your program.